I would say on an average, I mean, specialists generally are seeing more, you know, revisions, you know, for GPs versus the other way around.
Yeah. So what is your response to this patient? What did you tell the patient?
Yeah, so I mean, you just tell them like, look, I know you're not. I mean, look, we have very smart patients, right? That we got engineers, doctors, lawyers. We have all sorts of patients. So even though you know, people like to make fun of Oklahoma and all this other stuff, our patients are pretty smart. You know, it doesn't take a genius to understand that, you know, implants shouldn't be touching each other, and they can understand how, you know, when a crown isn't fully seated on an implant, like that case that I was showing you. So I just tell them, look, I was like, I'm actually amazed that they were able to get those two implants, you know, parallel. I mean, they're crazy close together. I don't even know how they were able to restore them, and I'm really surprised that this is even fixable. And they understand. They're like, hey, it looks messed up. I had no idea because nobody's ever shown an X-ray of my situation to me. And you show them the CBCTs and all this other stuff. I just explain what the problem is and how we need to fix it. I don't try to go into, you know, how, why, or, you know, what the other, you know, previous surgeon was thinking when they did the case. I just tell them that, hey, look, this is what you need to do to fix it. If you want me to be your guy, great. If you don't, that's cool too.
So are you getting a general dentist that sends the case to say uncover the implants, or what was this case in particular? Was this a general dentist that referred this case to?
Yeah, so this one is general dentist referred the case from Arizona. I live in Oklahoma, and patient lives in Arizona, and he flew out and was like, hey, I want to be treated for, you know, peri-implantitis. You know, there's bone loss between my two implants. There's pus, blood coming out. It doesn't look very good. Call the general dentist. He says, look, dude, this thing was, you know, most of the models is, you know, specialist places the implants, restorative dentist restores the implants. That's kind of the general model. This one was super GP is like, I guess, a term that we're all familiar with now. Super GP does everything, and just says, look, things went sideways. I did, you know, I tried to recover and I couldn't. So typically for me, it's like I saw one of your webinars, I went to one of your courses, and I'm going to send this guy over to you to get this thing fixed.
Well, I will tell you, you're not wrong. It does take some skill to put those two implants next to each other like that. So, you know, it does. I mean, there is skill involved, that's for sure. What do you think, Rob? Like, what's the mindset here? I'm sure you've seen a few of those in your 20-year.
Yeah,
Rob,
you know, I think
one of mine before.
I'm sure you've seen mine too. I think the saddest part, the only sad part about that story, as great as David is, and you are, is that the general dentist is referring a patient to a clinician in another state. So this is no longer a question of should general dentists be placing dental.